Good morning. Thank you for joining us. My name is Les Jones. I'm a business development manager with Careflex. My colleague,
Morning.
Rebecca. Rebecca is our clinical specialist. She'll be leading the presentation this morning. Just a little bit about the presentation. It's specialist seating for the elder person. It's going to be split into two sections. The first section will be theory and will be a series of PowerPoint slides. Rebecca will deal with that for us. Second part of the presentation, then we'll be using some case studies and some chairs from the range to illustrate some of the application of the theory that we've just discussed with Rebecca. So if I just leave Rebecca,
Yeah, I'll set it up.
Pop off to set her side of the presentation up. If I can just cover a little bit of housekeeping for the virtual presentation. This should have happened already, but can you make sure that your camera is switched?
Sorry, Les, we've been muted then.
All right. I'm not sure if you picked that up then, but yeah, joining us as well is Jess McDonald from our head office. Jess will deal with any kind of technical issues. I'd encourage you to use the chat feature. Jess will pick up any queries that you have there. Yeah, I think we're ready to start there.
Yeah, just to say that if we don't get round to answering some of the questions, we will be sending a pack out. So everyone who's registered for the webinar, pack will be going out with a copy of the presentation. Feel free to make notes, but you will get a copy of the presentation, the case studies, and then any answers to questions we don't meet then at the end.
Okay, I'll hand you over to Rebecca to start the presentation, and I'll see you in about 20-25 minutes.
Lovely, thank you, Les. So hopefully everyone can see the full screen now of the presentation. As Les mentioned, if you've got any issues, technical issues, pop in the chat and Jess will be able to help you out. As Les said, my name is Rebecca. I'm clinical specialist at Careflex. I am a physiotherapist by background. So posture management has been a really key objective of mine with individuals I work with throughout my clinical practice, because I specialise straight away upon graduating into learning disabilities and neurology, and that's where my passion for specialist seating comes from. So what we wanted to focus on this morning was specialist seating for the older person, some hints and tips that will hopefully help you within clinical practice when you are prescribing specialist seating for postural as part of somebody's postural care programme. Now, what we mean by older person is any individual aged 65 and over. Now, currently in the UK, there are 11.9 million older people. Now, with ongoing advances in technology, healthcare and lifestyles, people are living longer than they might have in years gone by. Some recent figures show that 18.2% of the UK population were aged 65 and over back in 2017, which is about 1 in every 5 people. And what the projection is that this would increase by a further 5.8% by 2037. So that would be around 1 in 4 people in the UK will be aged 65 and over in the next, 15 years? Yeah.
I'll take you over it.
Quick math there. Now, as we get older, it's inevitable that with age comes an increased risk of illness and disability. It's estimated that there are around 14 million older people in the UK who are living with a limiting long-standing condition, which is about 40% of all people aged 65 and over. Prevalence rate of dementia increase as well as we get older, and in 2019 it was estimated to be around 7.1%, and frailty as well becomes more prevalent with age. In individuals over 65, it affects around 10% of people, and then as that age increases, if we're working with individuals who are age 90 and above, it can increase to around 65% of them who will be affected by frailty. Posture can be affected in the older person due to levels of inactivity and general weakness, and that can be with or without an associated illness or disability. Frailty, as we know, which is characterized by this progressive decline in physical, mental, and social functions, can then significantly exacerbate those problems. And you might see things then like poor postural control and pelvic instability as gravity takes hold. Gravity then can trap individuals in these destructive postures. And the problem with gravity is it often exaggerates any asymmetries and will then lead to unequal loading of the tissues. And then what you might see is individuals who are often slumped in a certain posture will lean into one side or even sliding down the chair. Now, posture is so important because it's directly related to a person's health, well-being, and quality of life. There are physical, psychological, and emotional effects of this body shape distortion, and poor postural care can have severe and life-threatening consequences. An older person who sits in an unsupported and/or asymmetrical posture is at risk of experiencing things like pain, fatigue, dependency, and poor physiological function. And this inability to maintain upright, so they've got this symmetry and an upright position at the trunk, has been associated with a decline in health. And individuals then, the older person might then experience recurrent respiratory infections or digestive problems, and then be in an increased risk of hospital admission too. So just as a visual aid here, just to really show how serious it can be, you can see the image there. You can see the spine, there's a scoliosis, you can see the twisting and the curving on the spine. And this, if you imagine all those organs, the distortion at the organs, the compression in the abdomen will have an impact on individuals' ability to breathe effectively, to be able to swallow safely, their digestion, even their cardiac efficiency and endurance. This is why it's so important that postural care targets all those body segments and aims for an upright, symmetrical position, but we'll cover that a bit later. Now, we've only got kind of 45 minutes with you, which flies by, but we just can't skip over really the importance of 24-hour approach to postural care. And a person's inability to sit out comfortably can result in them becoming confined to their bed, which of course will mean limited interaction, engagement, and just being confined to the four walls, which will of course have an impact on their well-being. But equally, the lack of appropriate lying support can then restrict their ability to achieve a good sitting posture. So we really need to understand the link between sitting and lying postures. For example, if we're working with an elderly lady with dementia who maybe adopts this very typical fetal position at nighttime in bed and could be in that position for 10 hours every night, how do we then expect them to be able to extend out into a good sitting posture comfortably and safely during the day? So we really have to have that full 24-hour approach to postural care. But of course, we're going to be focusing on the specialist seating aspect today. There are lots of references available, so when we send this pack out, if this is something that you might be new to or something you want to refresh on, then certainly 24-hour approach will make sure the specialist seating aspect is at its optimum, really. So thinking about the older person, thinking about that particular population, these are the main postural challenges that we're going to be focusing on. Discomfort, fatigue, posterior pelvic tilt, that pelvic instability, an increased thoracic kyphosis, wind sweeping, an increased risk of falls, and an increased risk of pressure injury or ulcer, depending on the terminology that you use. Now at Careflex, comfort is really our top priority when we work with individuals. I mean, when I first qualified with my physio head, it was probably a very different approach, but certainly now achieving that comfort is what will ultimately ensure compliance with a piece of equipment. Now, prolonged or destructive postures can cause tension on the body and increase an individual's risk of significant pain. By ensuring proper positioning, we can then achieve that key objective of being comfortable within the chair. A supportive sitting posture can be effective in normalizing tone and movement as much as possible. So I said about compliance, being comfortable and feeling safe will aim towards increasing that individual's tolerance of a desired seating position, and ultimately, as I mentioned, compliance with the piece of equipment. If an individual isn't comfortable, then they will simply not use the chair, regardless of the clinical benefits that we are trying to sell to them. So second, we have fatigue. I do apologize, there's a lot of information here. And as I said, if we will be sending a pack with a lot more information on the slides as well. So if you're trying to keep up with us, then we will be sending out these packs, so don't worry.
Yeah, and there'll be a copy of the presentation itself,
yeah,
of the recording.
Yeah, of the recording, that's right, yeah. Okay, so secondly, we have fatigue. Now, fatigue can affect all aspects of an individual's life. It can restrict their ability to engage in daily living, as well as having a negative impact on them psychologically and socially. An unsupported posture causes fatigue by making inefficient use of the body structure and the body segments. Gravitational forces can then make sitting effortful for individuals who present with muscle weakness or abnormal muscle tone. I don't have any damage to my body systems, but I can certainly feel the effects of gravity towards the end of the day. So just imagine what it would be like for the individuals that we work with who have generalized weakness or abnormal muscle tone on top of that. Gravity is unrelenting, and it's you can't get away from it, and it can have certainly on posture, it can have a significantly severe impact on somebody's ability to achieve symmetry and maintain this erect, upright position. Fatigue itself can be associated with postural challenges, even without damage to the body systems. If somebody doesn't have a good energy management, we can still see severe postural challenges like an increased thoracic kyphosis, pelvic instability, and fixed deformities if they remain unsupported. And then we start seeing joint changes and soft tissue changes that unfortunately can become irreversible. Independence, as you know, I think we've got an audience full of OTs. But as you know, independence is crucial for an individual's well-being, and it's an important factor in living a fulfilling life. Functional movement is also important to protect the body structure and reduce the risk of injury, because we're keeping the body moving, we're encouraging blood flow, tissues and cells are getting the oxygen and nutrients that they need, so we're protecting the body segments as well. If we're working with an individual, an older person who is low on energy, or they're weak and they're unable to manage those energy levels against gravity, then function and independence can become extremely difficult. Another aspect of this is interaction and engagement, because fatigue can have a severe impact on that. An inability to sit out comfortably and efficiently, as I mentioned before, can result in them being confined to the four walls of their room with limited opportunities for socializing, because they simply can't achieve a good sitting posture during the day. Loneliness and isolation have been found to be twice as harmful as obesity to physical and mental health. It's also worth mentioning as well, for those of you who are working with an older person who also maybe has dementia or other cognitive impairments, the introduction of seating systems at the appropriate time, research has been shown that can also facilitate cognitive development. An upright sitting position can offer individuals a better line of vision for interaction and also allow them to increase their ability to achieve cognitive tasks. As I said, all these references would be going out with the packs as well. So if you needed any of this justification for funding requests, so you've got the references and got the evidence base there for that, then we'd be happy to share that. So early implementation of fatigue management strategies into daily life is critical, and it could reduce the impact of fatigue becoming chronic. Energy conservation will make it easier for individuals to live a meaningful life. Now, specialist seating and seating solutions can help. If we have adequate postural management and support through full body support within using the chair functions, then we can enable users to maintain an optimal sitting position for longer periods without becoming fatigued, whilst maintaining that pelvic stability and the trunk in midline to encourage the body segments to work efficiently together. Things like tilt in space, as long as it's safe and appropriate. Again, that's a whole other topic that we could talk all day on. So if anyone wants any advice on the safe use of tilt in space, then please do let us know. But tilt in space, if it's safe and appropriate, can help individuals with low muscle tone.
We'll talk about tilt in space a little bit.
Yeah, we will when we do the case studies, yeah. So you can get an idea and actually visually see what tilt in space can do to help. But if somebody has low muscle tone or reduced muscle strength, it can help them to manage their available energy levels and promote rest, because it reduces the effects of gravity for a period of time onto different parts of the body. So they can hopefully conserve energy, recuperate, come back upright to then direct it into activities of daily living that is important to them. Another function, if it's safe and appropriate, is back angle recline. And again, we'll show you the difference later on when we do the case studies between tilt in space and back angle recline. In terms of comfort and energy management, and fully supporting the body, it might be indicated to accommodate any hip contractures. So if somebody has reduced range of movement at the hip joints, or the knee joints, things like a negative angle leg rest can accommodate knee contractures to help manage pain that might be associated with that. Thirdly, we have a posterior pelvic tilt. This is essentially where the pelvis is rolling backwards. You can see in the image on the left there, also known as sacral sitting. So somebody rolls backwards, and the ASISs, so the anterior superior iliac spine, those of you who are confident with hands-on assessment, the ASISs can be used to help guide and assess movement at the pelvis, but they become higher than the posterior bony landmarks. Intrinsic causes include, so when you do your assessment and you're finding out what the causes of it is to then determine whether something is fixed or correctable, what you might find is there's pelvic instability, there could be limited hip flexion range of movement, tight hamstrings, weak abdominals, so they're falling into that position. As I mentioned about gravity, bringing them falling into that position because the core strength isn't there to remain upright, and then fatigue.
And that element of knowing whether it's fixed or correctable is key for us. Really important we know that up front, because it'll affect the type of chair or the type of solution that we look at. Yeah.
A posterior pelvic tilt can be associated with an increased thoracic kyphosis. I can see in the image there. Cervical spine extension, because the individual is trying to maintain this functional visual field, so they're hyperextending at the neck to be able to look upright, even though their thoracic region might be fixed in that rounded position. There's also a tendency to slide forward in the seat, so there's a risk of falling out of the chair there as well. Also increased shear and friction forces as the person is sliding down into that position. So that's increasing the risk of pressure injury over the sacrum, but also the apex of that kyphotic spine as well. So the management of a posterior pelvic tilt, as Les mentioned, will be completely dependent on whether that is fixed or whether it's correctable. The aim, regardless, is to support the pelvis in all planes of movement to promote that pelvic stability and keep the pelvis secure at the back of the chair. Some seating solutions, of course, this is completely individualized and dependent on, but some of the potential seating solutions are a ramped base or tilt in space to encourage pelvic positioning at the back of the chair. A pelvic belt following a risk assessment may also be indicated. A contoured back can fully support the shape of the spine. We also need to make sure that we appropriately position the foot support. Even though the feet are considered a load-bearing role and as part of somebody's moving patterns, as part of their mobility, actually in sitting, we still will take 19% of our body weight through our feet. So it's a critical body segment. And often we see, sadly, foot plates removed, uses door stops on top of wardrobes.
Don't really understand the relevance and the importance of providing that foot support. Sometimes it's overlooked, but it's a key, key component of specialist seating. Yeah.
Not only, I mean, we talk about the pelvis as the foundation of the sitting because it dictates what happens above and below, but all the other body segments interact with each other. So if we lack that foot support, and suddenly we've got 19% of our body weight just going through our buttocks and the thighs, and then wondering why somebody might be getting redness over their sacrum. So it's just thinking about all those body segments and how they work together and getting that stability throughout the entire body structure. We also then, if somebody does have a fixed posterior pelvic tilt, then we also need to address any originating or resulted increased thoracic kyphosis as well. And then as we go through the case studies with Les, some of this will hopefully make a bit more sense then when you see it in action. Now, another key part of somebody's seating prescription is actually the chair setup. This is a key part of an individual's care plan because the chair is only as good as how it's used and how it's initially set up.
No substitution for good care.
No. We need to ensure that the chair is set up correctly for the individual's body size, but also their critical angles for sitting. Because historically, we've always done these full day training events, and we can demonstrate and get people sat in chairs just to see the impact of this. So if you do get an opportunity to have a go, actually how wrong seat height, how wrong seat depth impacts on your posture, then please do that. And hopefully we'll be back doing full training days soon anyway.
And you know, what we're kind of alluding to is the setup of the chair. You know, the setup is as important as the original assessment. The devil's in the detail is the finer little adjustments on a chair that make the difference between success and failure.
Now, things like a posterior pelvic tilt, of course, we've got the intrinsic causes that we run through, but actually, regardless, I don't have any damage in my body systems, but if I was to sit in a chair where the seat height was too high, my feet were dangling, I would be naturally seeking that proprioceptive feedback through my feet. And I would be sliding down the chair just to get my feet on the floor and causing that posterior pelvic tilt, regardless of any damage to my body system. So it's really key that that setup is correct for the individual. So things like the seat height being too high, the seat depth being too long, the armrest being too low, lack of adequate foot support, as I mentioned. If you've got the back angles set up incorrectly for hip range of movement, or even things like inappropriate use of the elevating leg rest, if somebody doesn't have that range at their knees to extend to the position of an elevating leg rest, we're going to be pulling them down into that posterior pelvic tilt. So it's just being mindful of those extrinsic causes as well for a posterior pelvic tilt to make sure they go back to basics and make sure the chair is set up.
And a knock-on effects with pressure care.
Yeah. Next, we have an increased thoracic kyphosis, as I mentioned, often associated with the posterior pelvic tilt, and can often be seen in the older person. So an individual with a kyphotic posture will present with an increased curvature of the thoracic region of the spine. So you can just see in the image on the left there, and at the top of the back appears more rounded than normal. This can be associated with a pelvic instability, scoliosis, and an increased risk of pressure injury, especially through that apex of the curvature. The sacrum, because obviously it's associated with that posterior tilt, but also the heels as somebody slides down into that position, and then suddenly they've got increased pressure going through the heels as well. Now, the issue with an increased thoracic kyphosis is that it can also present with physiological dysfunction. And what you might find with the individuals you work with, that they could have respiratory or digestive problems. They could have swallowing difficulties if they're unable to achieve this safe position for eating and drinking. It can also result in their eye line being towards the floor, so their head position would be towards the floor, and that can have a significant impact on interaction and engagement as well. As with any other body segment, management will depend again on whether that increased thoracic kyphosis is correctable or if it's fixed, which would be identified during the postural assessment. But some seating solutions that can help this postural challenge include a waterfall back. And as we go through the case studies, Les can show you the different options of back support as well. But a waterfall back can be helpful if somebody is still able to maintain an upright sitting position, so they don't really need that lateral support. But what we can do is we can adjust the wadding in the middle section, so in the thoracic section, to accommodate that curve, that apex of the curve.
We'll illustrate that as part of the case study, because that's just the solution we looked at for one of the ladies in the case study.
An articulated headrest can, if somebody does have quite a fixed posture, I tend to go off, I tend to,
on a tangent.
yeah, I tend to go on a tangent with these things. But if you imagine an individual who has quite a severe fixed kyphotic posture, so if you imagine this gentleman, actually gravity's taken further of a hold. If we don't manage it in a few years' time, it could be a really severe thoracic kyphosis, and he becomes fixed in that position. We're going to find it very difficult to correct that. So we can't bring that individual to the chair. So what we need to do is essentially, with specialist seating, we need to fill in those gaps. So we might need to then start adjusting the chair around the individual. So things like an articulated headrest means that we can bring the headrest towards the individual to make sure they've got that head and shoulder support for maximum comfort as well. Sometimes an anterior support can be helpful. If somebody's got that feedback from the front, it can be helpful for a thoracic kyphosis. Things like a chest harness following a risk assessment might be indicated. Just getting feedback simply from a tray. We've had good, we've had effective success with using a tray for their anterior support, putting a V cushion on top of the tray, so they've got that feedback.
Shoulder girdle.
Open up the shoulder girdle. We've had good, good feedback from that. Tilt and space, if appropriate, can encourage that pelvic stability and energy management. But what it can also do is use gravity, actually to good use this time, and we can try and use gravity to open up the shoulder girdle a bit further, and maybe get some mobility in that region for a period of time while they're rested, to try and reduce the risk of further contractures and further tightness of the muscles happening. And then we, of course, need to address any associated posterior pelvic tilt or scoliosis. Thinking about the chair setup as well, which is really key. I'm going to be mentioning this for every single postural challenge, but we need to make sure that the correct seat depth, seat width and armrest height is set up for the individual. We need to ensure adequate trunk support, but also adequate head support as well, because that's a really key part of encouraging optimum physiological function for them, and interaction and engagement. So next we have wind sweeping. I know a windswept deformity, very technical term, wind sweeping, but a windswept deformity is identified by the abduction and external rotation of one hip and the adduction and internal rotation of the other hip. But it is a whole body system postural challenge. It's not just isolated to the lower limbs, because of the impact that it can have then on pelvic obliquity, on the spine. There could be a rotation happening, or a scoliosis, pelvic rotation with a spinal rotation, and even a posterior pelvic tilt. So we need to think about it as a whole body system postural challenge, which is what we would do anyway with any kind of seating prescription, is think about all those body segments. If it becomes unmanaged, then it can result in increased injury, pressure injury risk, especially in the groin region, and overall postural deterioration. One of the causes of this wind sweeping that we might find in the older generation, in the older population, is when I mentioned about lying postures. If they go into this typical fetal position at night time, especially individuals with dementia, then wind sweeping could be a postural challenge that's started in lying and then is compounded in sitting. So just be mindful again of lying and sitting postures and how we encourage them to both work together to try and reduce the risk of those contractures happening. When I mentioned about obviously the postural assessment, trying to find out whether something is fixed or correctable, it's worth noting with wind sweeping that we should not be correcting. I mean, it's pretty self-explanatory, but just to reiterate that we should not be correcting a fixed windswept deformity, because this can cause undue pain. If the posture is flexible, then the seating goal should be to correct that wind sweeping gradually whilst addressing the associated postural challenges. And again, going on a tangent, but one of the key things we say is, especially with specialist seating, is to have that gradual introduction to that new setup for the individual. So what we can often find, if there's no set care plan in place, that somebody's maybe been confined to their bed for a period of time, and then suddenly they're sat out for 10 hours a day.
Yeah, we need to be realistic about what we can achieve and the time scale involved in.
Yeah, it might be that somebody can tolerate that for an hour one day, and then we gradually increasing that over time.
Building tolerance. Yeah,
building tolerance, definitely. And that's where the care plan would play a real key role. We've got lots of things on care plans as well on the website. So if anyone needs any assistance with that, then please do get in touch.
If you visit the website, it's the info at section of the website. You'll find a whole host of clinical, technical, how-to videos there as well. So it'll give you a lot more detail on what we're talking about this morning. Yeah.
So when it comes to wind sweeping, some of the seating solutions, again, these are just potentials, completely depends on whether it's fixed or correctable on the individual and what their tolerance is. The gentle approach would be a contoured cushion if we're able to correct it, because we can encourage that pelvic stability, but also that optimum thigh alignment. However, if somebody has quite strong wind sweeping, or if they've got fixed wind sweeping, then we might then need to look at something like a pommel, which may need to be offset to the left or right, depending on which way their legs are wind sweeping. Things like a channeled or a W trough leg rest. Those of you who use nighttime positioning, for example, might know what that W trough is. We can actually look at things that's bespoke within specialist seating to try and replicate
solutions option as well for solutions
to try and get that alignment in the lower legs, because as we know, every body segment affects the other. We need to ensure that the back angle recline and leg rest angle accommodates any contractures, or that a negative angle leg rest may be indicated as well. And then, as Les mentioned, the tailored seating solution for complex postures, such as things like a split leg rest. So if somebody's got unequal knee range of movement on both sides, splitting the leg rest so that we can accommodate different ranges of movement as well might be indicated. Again, if somebody wants more information, I think there's lots of photos as well. Yeah. And of course, we're going to be covering the chair setup again. I'm going to drill this into everyone, but we really need to make sure that that initial setup for the individual is correct. If we prescribe seating that doesn't provide adequate support and alignment, then this can impact on wind sweeping further. Things like the seat depth being too shallow, the seat width being too wide, the seat height being too low, or the leg rest length being too short. If we think about, for example, if somebody has a fixed wind sweeping to the right, and we can be really prescriptive about things like seat width and say is hip width. But actually, if we're working with complex postures, we might need to actually take the widest point of that individual, and we might need to increase that overall chair width, the seat width, or think about things like an extended lateral thigh support pad, so that we are either encouraging alignment or accommodating and protecting those areas, especially things like through doorways, just making sure that if somebody has been manoeuvred from rooms and they have a fixed wind sweeping, that's not going beyond the chair. So we might need to increase the seat width to accommodate that and protect the knees. Next, we have falls. Reduced postural control can increase the risk of falls, because what we might see is individuals who we work with sliding down the chair, out of the chair, or falling during transfer. So it's not just we're not just thinking about falls from standing, but actually falls from the chair as well. If somebody has generalized weakness from immobility or even deconditioning because of the lack of activity, this can also increase the risk of falls. Now, as we know, falls can be devastating for the individual, but also for the wider healthcare system too. The human cost will include distress, injury, loss of confidence, and increased morbidity and mortality, sadly. One of the key things to mention there is that this would also link into comfort and compliance, because if an individual feels secure within the chair, then they're more likely to then use it. So we want to make sure people feel stable and secure within the chair. Staying active, obviously I'm a physio, I encourage people to remain active, will not only improve their health, but research has found they can actually improve cognition, confidence and mood. The pelvis must be stable, the feet adequately supported to promote that postural stability, and then enhance those feelings of security that help keep the user in the chair. And again, the success of that sitting posture will only be as good as the initial positioning. Specialist equipment should also encourage any skills that relate to activity. So that links into that independence and function as well, whilst also considering their safety. Some of the seating solutions that can help include contoured cushions to help stabilize the pelvis within the chair. Something like a tilting space or a ramped base can further promote that pelvic stability. So it can help reduce that sliding down the chair, reducing that shear and friction forces, and hopefully reduce the risk of falling from the chair as well, because the pelvis will remain. Belt and chest harnesses. There are simpler safety belts as well, like lap belts, that can offer security and safety during portering. The seating prescription must always be compatible with the older person's mode of transferring, especially when we're thinking about safety and falls prevention. So if somebody is ambulant, if they're still able to do sit to stand transfers, then we must ensure that the seat height encourages that safely. If somebody does side transfers, for example, we need to consider things like removable arms. We must also think about those who are no longer ambulant. If they're fully hoisted for transfers, then the chair setup must also assist this, because we need to think about the support network as well, not only for positioning within the chair, but things like removing the sling can often have an impact on their positioning. So removable arms, for example, can be helpful to aid the fitting and the removal of the sling without impacting on their positioning. And then lastly, we have pressure injuries and ulcers. Of course, there's a whole list more, but we wanted to focus on, as I mentioned, we've only got 45 minutes with you. But when we think about pressure injuries and ulcers, I guess the main takeaway message here is that posture and pressure are inextricably linked. The body can only withstand these high interface pressures for a very short period of time. And when that load in the tissues is unequal or the pressure isn't relieved, then pressure ulcers can occur. And when they do happen, they can have a profound impact on overall well-being. Pressure injuries in the older person are actually associated with a 5-fold increase in mortality, and they can be at risk because of their prolonged rest or immobility. Now, in terms of pressure care, the research has shown that the appropriate management, or better still prevention, will ultimately improve their quality of life. And the key intervention for this is pressure redistribution through regular repositioning. And there are different guidelines that are available as well. Different degrees of tilt can help. There's lots of research out there. Again, we'll share this information with you. Guidelines that can be used, like NICE guidelines, but also NHS guidance as well. This is totally individualized to the individual. Some people might need to change position every 15 minutes, whereas some people might be okay for 4 to 6 hours. Again, we can only give you the guidance on that. And essentially what specialist seating aims to do is to reduce the risk of pressure ulcers by distributing the user's body weight evenly throughout the chair over the maximum surface area. And on that opportunity to sit out can offer a much needed regular change of position to encourage blood flow and redistribute pressure. And of course, we need to mention as well just about the support network. Often you might be working with individuals who require support from family, from friends, maybe they reside in care homes. Now, the safe and appropriate specialist seating prescription should also support the individual's family, friends, and or carers. Again, on the website, we've got lots of articles on care home environments, nursing homes, residential homes, and actually how specialist seating can help support networks as well. So if you need information on that, then please do let us know. I think it'd be really key for us now to get into the case studies.
Yeah, we'll have a look at that.
Yeah. But just as a recap for good sitting posture, what we're looking for is that the bodies conform to the supported surface symmetrically. Those of you who are, I don't know whether you can see it on the screen there or whether it's covered, but those of you who are interested in posture management might have heard of Pope, Pauline Pope, and it's just a really good checklist when you're doing your seating prescription to make sure the bodies conform symmetrically, body weight distributed equally, balanced and stabilized, but it can still adjust to change depending on activity at hand. If we do need to change position, it still remains stable within the chair. So reaching outside the base of support, for example. The body segments are supported and aligned as much as possible, but the upper limbs are free from the low bearing roll for functions. We don't see elbows digging into the back of the chair or individuals clinging onto the arms of the chair because they feel stable. Their upper limbs are free to engage in activity and function. That's a very whistle stop tour. Stop sharing. Hopefully you can see us back on the screen.
Okay, so this section now we're going to be looking at chairs within the range to illustrate some of the theory that Rebecca's discussed with you this morning.
Yeah, it's a lot of information, I'm sorry. So
we've got two case studies. Case study one is a lady called Mary.
So do you want me to run through?
Yeah, I want to run through.
Yeah, so Mary was a 76-year-old lady who lived at home, diagnosed with Parkinson's disease, so presented with a very typical flex posture and leaning. The support network was starting to notice redness over the sacrum, the back, sort of the thoracic region, and the heels. And at time of referral, Mary was semi-ambulant.
Yeah. So the assessment process, we potentially look at any chair from within the range for Mary, and the range goes from complex with a Smart Seat Pro to moderate with the multi-adjust, and more complex with the Smart Seat Pro and the HydraFlex. Sorry. Then the main issue for Mary when we met Mary really was the decline in her core strength, because initially we thought it may have been a rise and recline chair, but Mary really needed a lot more support than we could get from a rise and recline chair.
Yeah.
And it's something we see a lot of is, people looking for that postural input from rise and recline type products where really they need something like a specialist chair, right, a tilt and space chair. So we did try the HydraFlex. I'll talk about that in a few seconds, but we came to the HydraTilt, and this just seemed to work really well for Mary.
Yeah, do you want to if I just quickly recap what we found the postural challenges were?
Yeah.
So in terms of the postural assessment that was done by the therapist, and then during the seating assessment, I guess the main thing was the reduced core strength, wasn't it? And the postural control.
Us,
yeah, the posterior pelvic tilt, the redness over the thoracic region, and obviously it was pretty obvious that she had that kyphotic posture as well, very typical in Parkinson's. Fatigue, an increased risk of pressure injuries. She already had those red areas, and also new falls. So I think the prognosis was that I think they were trialing hoisting, and the prognosis was that she would be a non-ambulant very soon.
It was kind of imminent, really, that kind of full hoist transfer. So we came to the HydraTilt. HydraTilt is a tilt and space chair. 30 degrees of tilt and space with a HydraTilt. Now this was really appropriate for Mary because it helped with fatigue, it helped with gravity, it just encouraged Mary to sit in a more open posture, and it took some of the effort out of sitting. It meant Mary could sit out for longer.
And the good thing about tilt and space, for those of you who may be new to seating, tilt and space is posture neutral, so it doesn't affect the hip and knee angles, whereas back angle recline would be opening up the hip angle. Just so.
And we'll look at the difference if we have time in a few minutes. If I run through the features of the HydraTilt, then we'll stop at the kind of key components that made the chair the appropriate chair for Mary. We mentioned foot support. HydraTilt comes with a padded foot plate and an elevated leg rest. The other thing to say is there's a lot of detail in what I'll be showing you now. If you need to know how to perform some of these tasks, again, if you go to the website, there's the info at section, you'll see some how-to videos, and it'll show you in a lot more detail what I'm actually doing to achieve some of these movements and functions of the chair. So hydro tilt, elevating leg rest with an angle adjustable foot plate. Really key to give foot support because, as we use tilt in space, you're actually raising that person's feet off the floor. Without the foot plate, we're going to lose foot support. And as Rebecca said, I think it's 19%. You said your weight goes through your feet. So we're not going to lose that 19%. That 19% is going to be redistributed elsewhere.
And as well, thinking about trying to reduce the risk of body distortion as well. If we didn't have that foot support, then there'd be a risk of a foot drop as well, because gravity would pull the feet down into that position.
When we look at pelvic stability, then we're looking at initially with the hydro tilt, the seat width and the seat depth adjustment. So we get a nice snug supportive fit for Mary when we tried her in the chair. Seat width we can adjust just by hinging what we call a saddle arm. This is the setup that I have on the chair at the moment gives me an 18-inch seat width or 450 mil. Just by putting a thinner or thicker arm on there, I can adjust that seat width. Seat depth, again, in a current chair, Mary was sacredly sitting. To be honest, the seat depth was a little bit long. What a specialist chair allows us to do is to find the exact appropriate seat depth for the individual. I'll show you how I do this on hydro tilt. It's quite similar on other chairs within the range. So there's a little lever at the back of the chair here, which I just press down. I hold that down, that releases a lock that locks the seat base in place. Then I just push on the other lever to increase the seat depth or decrease the seat depth. Very simple operation.
Yeah, just as a takeaway tip there, really, if you are getting referrals and if somebody if maybe family are concerned about somebody's posture within seating, do check the basic setup first. Because sometimes it can be quite an easy fix.
It could be quite an easy fix, and it could be quite a simple fix. There may be just a more appropriate chair available with a better seat width and seat depth and seat to floor height. So we've looked at the pelvic stability was a key issue for Mary. Pressure care. All the Careflex chairs that have built in pressure care are standard. It's what we call water cell technology. Gives us a medium to high pressure care rating. But what I always like to point out is that's just one element of pressure care within the chair. The chair itself is a system that helps with pressure care. So when we've got the correct seat width, seat depth, foot support, we come to lateral support in a second, it's the optimum way of providing pressure care.
But then we also need to make sure, in line with guidance, obviously the best management would be to ensure then still getting that regular change of position. So of course we've got an initial setup, but then we still need to adjust that posture throughout the day, whether that's through different equipment or whether that's through using things like tilt and space so we can get different body weight distribution throughout the chair.
And the pressure care in Careflex seating is known as water cell technology. Again, if you want to go to the website, you'll find a lot more detail on how that works. But basically, it's a hydro tilt, hydroflex. It's a water-based system. It's a combination of memory foam and high elastic foam on 3 water cells with a 4-way stretch breathable fabric. And what happens is, as you get high pressure points, come into contact with the seat surface, the 4-way stretch fabric allows the pressure care beneath it to work effectively. The memory foam reacts to the body heat and conforms to the body shape, and the water cells displace. So simply speaking, what's happening is when we get a high pressure point, it becomes absorbed into the seat surface. I don't know if you can see, but the surrounding surface then rises to spread that pressure over a greater area.
So that, in combination with tilt and space, for Mary was part of her management plan to reduce those red areas, but then also as part of the care plan, making sure that she did have then a change of position throughout the day as well.
Pressure care system. And I'm just thinking, we've mentioned tilted space, the chairs we have with us today are manual, but another important feature may be to consider providing power to the operation. So that would give us powered, electrically operated tilt and space movement. Now that may be handy for Mary to have an impact or to have a control over her own posture when she sits in the chair. It may help with carers, perhaps an elderly spouse to control the chair. Especially with hoisting as well, it's a good tip. Sometimes tilting the chair back can help with hoisting, because gravity will essentially then position the pelvis at the back of the chair. Yeah. Just to assist with that. And you know, movement is great as well for pressure care. So there's a function called auto tilt, which will rotate or cycle the chair through its range of tilt and space over a given period of time. Coming up to the thoracic and lateral support. Mary was struggling a little bit with sitting balance. It was okay, but she was still listing slightly to her right. We did try to, this is a contoured back, it's one of the options on a hydro tub, just this contoured shape here, just to kind of prompt Mary to sit in a more of a midline position, but we just couldn't quite get it right. And to be honest, she didn't really find it that comfortable. And you know, as we've said earlier on, comfort's a key part of the solution, because if the chair's uncomfortable, we're not going to want to sit in the chair. Yeah, and it's very subjective, so we have to trust the individual and their feedback on that. So we did try to adjust different components within the back of the chair. You know, this will give interest to lots of you who are accessing products through equipment stores, just to see that you can actually take a Careflex back into stock, reconfigure it, and perhaps order a different back style or a different footplate style or different seat width and different seat depth. The chair can be reused in between clients. So we just peeled the back away from the structure of the chair. We tried to rearrange some of the water cells and the foam lozenges to give us a bit more support, but it just didn't work. And again, Mary was uncomfortable. So what we tried was we took the back away. Part of pressure care. Back is the water cells I mentioned earlier. Get those out. And we tried a waterfall back. So these 3 cushions, very modular design of chair, so that you know the components can be swapped and changed. And this is the back that I mentioned that can be particularly helpful for individuals with that increased thoracic kyphosis, because that middle section, that thoracic section, we can actually adjust the wadding so that it can fully accommodate the spine. So we're allowing them to immerse themselves into the chair. So that's Rebecca's stolen my thunder there. Really. Sorry, that's exactly what happened with Mary. We managed to absorb the kyphosis and to spread the pressure. Mary found it really comfortable. The one slight issue we had was that waterfall back is great for comfort, but sometimes it loses a little bit on lateral support. So we mentioned earlier that we've got a facility called Tailored Solutions, which basically provides us with a unique bespoke component for a chair. And what we did with the back for Mary was we took out the center section, and rather than it being just one cushion, we made it into 3 separate cushions within the cover, so we could give Mary a little bit of contour and to keep her in that midline position. I think that's Mary. Yeah. Have we got time to look at Tom? I think so. Yeah. Yeah. Sorry if we're taking a little bit more time, but as I think we said earlier on, really, to cover specialist seating in an hour is a big ask. Yeah, and if there are questions, we will respond to them. If we can't do it during this session, then we'll come out with a pack. We'll respond to all those questions. So Tom, just quickly, an 81-year-old gentleman who resided in a nursing home, vascular dementia with frailty. He was hoisted for all transfers, and his limited
he had very limited independent functional movement, and was having recurrent pressure injuries and respiratory infections. So his physiological functioning was a key part. Postural challenge-wise, of course, the generalised weakness that comes with that frailty, pelvic instability. He also had that kyphosis, and then the impaired physiological function and risk of ill health and hospital admission.
The other important thing just to mention as well is the environment. Mary was at home with her husband who was providing a lot of the care. Tom is in a nursing home, and that impacted a little bit on the style for the options for the solutions as well. We did look at 3 chairs for Tom potentially. We looked at a chair called the Smart Seat Pro. It's a little bit too complex, really. Tom's not really going to get the benefits from the adjustability that's in the back of the chair. Plus, a complex chair in a care home setting can cause us issues. So
there's such a thing as overprescribing.
It's overprescribing, yeah, exactly. We looked at the tilt, same as we did for Mary. This is a bit like the 3 bears, isn't it? Not too hot, not too cold. Just wasn't quite right. And what we'd identified was that Tom needed a little bit of back angle recline, just for comfort mainly. He didn't tolerate sitting at that fixed angle that the Hydro Tilt gave us. So tilt and space, energy management is key for both. You know, our tilt and space is great at that. Just to point out, tilt and space with the flex is slightly different than the tilt. It's got what we call a negative tilt. So you've got the semi-ambulant, you can put feet flat on the floor for them to transfer out of the chair. So 30 degrees. Elevating leg rest. Again, this is manual. All this would have been adjusted for Tom. Slightly longer legs. Appropriate seat depth. Adjusted at the back of the chair, very similar to the way that I adjusted the Hydro Tilt. Options for arm height. So we went for a slightly higher arm height for Tom. Pressure care of the seat cushion. Again, the pressure care of the seat cushion just is a component of the pressure care system provided by the chair. Tom was leaning slightly to the right. We did look at an adjustable lateral back for the chair.
But because of the frailty, we needed comfort to be,
which allows us to use laterals, adjustable laterals into the back of the chair, which can be moved up and down.
Sorry, I just quickly see somebody asking, this is a Hydroflex.
Yeah, Hydroflex.
Yeah.
And the laterals, again, in the care home environment, and because we were opening up the back angle slightly, just didn't work. They weren't quite comfortable, and they created more of an issue for us than the potential solution they could offer.
Yeah, before I go off on a tangent again, if people need any more information on back angle recline, because it is one of those functions, and when it's used inappropriately, it can have such a huge detrimental effect to somebody's postural stability. So if anyone wants to any information on that we can share it as well. So
we're running out of time. Top clock is ticking away. Yeah. We opted for the contoured back, a nice deep shape in the back of the chair, which was quite comfortable, and Tom quite liked the support that it provided. For the thoracic, the top section of the Hydroflex articulates. So basically, we were matching the spinal profile of Tom. And again, we were accommodating. You can see now how important it is to know if we're accommodating or fixing as well. Or yeah, that's correct, isn't it? Accommodate or fix.
Yeah, so we couldn't correct his posture. Yeah,
what I was looking for. Yeah. We considered using pelvic strap, 4-point pelvic strap. Didn't really need that.
Yeah, because he had limited movement anyway. He was unable to change his position in terms of safety and maintaining that positioning. Once he was sat in the position, he tended to stay in it. So it was actually, we needed it into the care plan. We needed to advise on actually encouraging regular activity rather than trying to maintain that positioning for prolonged.
The other consideration we tried was, you'll see the Hydro Tilt standard water cell cushion is a flat surface. We just tried a contoured seat cushion. You can see there a ramp at the front edge, just suggestion of a pommel in the middle, just to prompt that midline and that linear position for Tom's, but we didn't really need it, and we didn't want to provide something that was overly complex. I think that covers Tom.
Yeah, again, lots of whiz throughs, lots of information to do in an hour, but we'll send out a pack with them.
Yeah, I mean,
with a lot of detail. Like I say, there's some people there who wanted some information on back angle recline and tilting space, so we'll include that as well.
Yeah.
Because they do need to be prescribed safely and appropriately. They're not appropriate for everyone.
Yeah, we'll take a good look at all the questions you've asked on chat. We will get back to you. We'll respond to each question. So what's going to happen now? Well, we're about to finish in a couple of minutes, but we will follow up with a pack of information, as Rebecca's already said. That includes a link to a copy of the presentation, a copy of the a link to the copy
of the webinar,
plus a copy of the presentation as well, plus contact details and some more information on the chairs.
I think there was just a question there about petite, just while we're here, just petite users. So they just say there are different ranges of sizes with the chairs.
I mean, all the chairs I have with me today are medium frame chairs. We do small frame versions of the chairs as well, which have all the same features and benefits, but just a scaled down version of the chair. And going the other way, we have a bariatric version of the Hydra Tilt as well, which takes us up to 35 stone weight limit and a 26-inch seat width. Yeah,
but definitely your petite, older ladies, frail ladies, we've definitely seated them in some of the chairs,
Okay, well, thank you all. I think we've had people from all over the world with us today, which has been a great great addition to the webinar. Especially
for us in South Wales, where it's very miserable today.
Yeah, there's some quite exotic locations we see popping up. So thank you all. Hopefully we'll have a chance to meet you. Keep an eye on our website. We'll try and keep you up to date on future webinars and presentations, Rebecca, blogs on a regular basis, whatever that is. Again, so thank you all, and I'll bring the presentation to an end.
Yeah, thank you very much.